Well, right now there are more than 1,000 people in line here at Feeding Tampa Bay to try and get food assistance. Look at all that. The line has been going for several hours now as people wait for Feeding Tampa Bay to open up. That's because the SNAP benefits that they had relied on have expired, and this month's payments have not yet.
What happens when the people hurting the most keep defending the politics they believe is supposed to save them? That's the contradiction at the center of this debate. We're looking at food pantry lines stretching for hours, rural hospitals shutting down, healthcare workers warning about cuts, and communities struggling with rising costs, while some of the same voters affected by these problems are blaming Democrats, immigrants, transgender people, or anyone else except the politicians and policies they supported. But there's an even bigger question here. Is MAGA actually solving rural America's problems? Or is it redirecting people's anger toward convenient scapegoats? Because when a hospital closes, culture war arguments don't reopen the ER. When SNAP benefits disappear, political slogans don't put food on the table. In this video, we're breaking down that contradiction, the economics behind it, and why rural voters can end up supporting policies that may hurt their own communities. If you want a deeper analysis, stay with me. Let's jump into the debate.
Game from the game played elsewhere is innovation, entrepreneurialism, more patents, more engineers, more researchers, more Nobel laureates in my state than any other damn state, more Fortune 500 companies in my state than any other state. Look that up, because I know people are rolling their eyes and saying, no, it's Texas. You're wrong.
It's true. I looked it up.
And we're, by the way, a donor state. We provided $83.1 billion more than we received from the federal government. Texas took $71.1 billion. I'm not saying that to bash Texas, but you know what? Pretty proud of my goddamn state.
I saw that
above
too.
Our weight, man. But AI.
Can you repeat those numbers?
$83.1 billion. We provided more to the federal government than we received. In the same year that Texas received $71.1 billion more than they provided to the federal government.
So you're net positive.
Net positive. 9 out of 10 of the donor states are Trump states, and I don't mean that pejoratively, Trump. 7 of the 10 are Republican states, but 9 out of the 10 dependent states, welfare states, are Trump states. The donor states disproportionately the blue states. 71% of the country's GDP comes from blue counties. Mm-hmm. These same crack-up counties with all these crazy liberals that can't get out of their own goddamn way and the world's come to an end. It's 71% of the economy of the goddamn country, man.
We don't have the finances to get groceries. If it wasn't for these food pantries and Feeding Tampa Bay, we wouldn't be able to survive. And that's really tough.
Within the last couple of months in my town and surrounding towns, we have had 2 ERs shut down. With that being said, we have had 2 people go to these ERs to get help, not be able to receive the help because the ERs are shut down. They have then had to be care flighted to the closest ER and almost lost their lives because they weren't able to get the help they needed fast enough. Someone brought this up in a local Facebook page in our town and brought up how these ERs were shut down because of the big beautiful bill. And in these comments, people were posting that the ERs were shut down because Democrats were not paying their medical bills. There were also comments claiming that the ERs were shut down because the hospital was giving free surgeries to transgender youth. I live in deep, deep Texas, very far in the country. I'm tired of hearing the whole, like, we have to come together, we can't be divided. You can't come together with these people. I'm married to a woman. I can't sit in the same room with these people. They would kill me. I'm not really sure what the answer is, and I'm not really sure what to do anymore. I don't know. I just wanted to let y'all know that it is taking effect. I knew that,
After looking at everything in this clip, I think the biggest issue isn't simply whether someone votes Republican or Democrat. The deeper issue is whether voters are honestly evaluating what their political choices are doing to their own communities. Because the people standing in those food lines are real, the families facing longer drives to emergency rooms are real, the nurses dealing with staffing shortages are real, and the rural communities watching hospitals, businesses, and opportunities disappear are real. The question is, who benefits when those people are convinced that their biggest enemy is another struggling person? You can blame immigrants, you can blame Democrats, you can blame transgender people, you can blame government workers. But none of those things automatically reopen a rural hospital, lower healthcare costs, create jobs, or put food on a family's table. And that's the contradiction this debate exposes. Anger can be politically powerful, but anger isn't the same thing as a solution. At some point, every voter has to ask a very simple question. Is my community actually getting better? Not whether my political team is winning, not whether someone I dislike is losing, but whether my hospital is open, my bills are manageable, my family is secure, and my town has a future. Because ultimately, politics should be judged by results, not by how effectively it gives us someone to blame.
For most things, it's hitting my town. And it's hitting it hard. And instead of blaming the people who are responsible, they are blaming Democrats and transgender youth. So.
Well, right now there are more than 1,000 people in line here at Feeding Tampa Bay to try and get food assistance. Look at all that. The line has been going for several hours now as people wait for Feeding Tampa Bay to open up. That's because the SNAP benefits that they had relied on have expired and this month's payments have not yet arrived. The federal government does say that they're going to be providing potentially half of those payments after a court order, but it remains to be seen as to when those payments can be sent. Right now, there are 500,000 people in Tampa Bay who depend on SNAP payments, and right now it is unclear as to when those payments are going to be coming in. Feeding Tampa Bay says they expect 1,000 people to try and get extra food to feed their families over the coming days.
Because the big beautiful bill is destroying healthcare and it hasn't even gone into effect yet. I'm a nurse. I work for a pretty large institution, and we're not getting all the funding that was anticipated from the government, and everyone's just like buckling down and terrified because of the big beautiful bill and the cuts to Medicare and Medicaid, which, if you didn't know, is like essentially where hospitals get most of their money, meaning employees are not getting raises, they're not going to be hiring people, they're cutting not corners, but they're cutting, unnecessary cost. And let me tell you, your time at the doctor or your time in the ER or the urgent care is going to be exponentially longer. We are running with minimal staff and it's brutal. And so I apologize ahead of time if you come to an institution and you wait a long time. Unfortunately, you can blame Trump for that. And if you voted for him, I don't want to hear one complaint come out of your mouth. Not one. Because guess what? This is what you voted for. So you get to enjoy it. The fruits of your labor, one would say. And, if they take away the thing that says that my brain's not working, but how you can go to the ER regardless of if you have insurance or not, and they take that away, people are going to die. They're going to die. And I know we don't really seem to care about people dying, and we don't seem to care about anyone in this country other than apparently billionaires. But I don't know. It's grim. It's grim.
Rural area that overwhelmingly voted for Trump, and they only have one hospital in this area. It's been serving the community for over 7 decades, has stayed open as the community has shrunk. They used to have a Walmart, the only Walmart in the area, closed, and through a lot of economic downturn, they have been able to stay open. But unfortunately, because of Donald Trump's big, beautiful bill, there are fears that it may close in a town that overwhelmingly voted for Trump. And frankly, I don't think they realized they were voting for this.
Rural hospital operators are asking for a lifeline in Austin.
Rising costs, patients moving to the cities, and new federal budget cuts threaten many healthcare facilities in those small towns. NBC5's Phil Prazen reports the impacts are felt already here in North Texas.
2 healthcare locations in Hunt County closed this month. The freestanding emergency rooms in Commerce and Quinlan, operated by Hunt County Memorial Hospital District. Laying off 43 people and closing the locations will save $15 million a year. In the announcement, the hospital board wrote increasing supply and labor costs, the growing number of uninsured patients, and declining payments from insurance companies and government payers have stretched the organization financially. John Hawkins from the Texas Hospital Association tells me in the near future, hospitals in rural areas may soon consolidate services in the large county seats, removing satellite and community offices because the numbers simply don't work.
I live in rural America. And if you don't understand what it's like to live in rural America, you can't possibly understand why these people vote Republican, why these people fall for conspiracy theories. Rural America has not one church, but 2 churches on every corner. And in these churches, they anoint hate. They anoint words that dehumanize immigrants, that dehumanize people of color, that dehumanize women. They don't understand that living in rural America is like living in a third world country. The infrastructure sucks. The job opportunities suck. The education levels suck. Nobody understands this unless you can actually live it. The people here live in abstract poverty with no hope of anything better. So when they see that somebody else might have it better than them.
The rural hospital crisis may be the most serious part of this entire clip.
They think the government is too big, not understanding that everything that the people that work for the government do. So they think that these people who work for the government make too much money and shouldn't have a job. If they can't make that kind of money and they can't have that job, then those people shouldn't have that job. They believe in snake venom. They believe in ivermectin. You can go to the local feed store and they sell more ivermectin to humans than they do to farm animals. They talk about snake venom curing COVID. They talk about ivermectin curing COVID. They talk about nicotine curing COVID, curing cancer. They hate vaccines. They hate science because they don't understand science. They don't care if their kids go to school. So their kids grow up not caring either. And until we change that here in rural America, we're never going to get them to vote for their best interests. They're always going to vote against their best interests because they believe that it hurts us. And that is rural America.
What this clip really